This is Satyender Goel. I'm the founder and CEO of India HealthLink, a company dedicated to bring primary healthcare services to India. So as we have seen, India has seen the new budget which has been released, and the Union Budget 2022-23 has a big push in digital healthcare. It has given healthcare much needed digital push. It is rolling out an open platform for national digital health ecosystem, setting up of National TeleHealth Mental Scheme, incentivizing startups, which would include health and most importantly, Drone Shakti program, which are one of the innovative ideas and right in the right direction. What government is considering, and rightly so, is how public-private partnership together can achieve that much needed digital push to advanced Indian healthcare, especially in the rural healthcare ecosystem. The other important, the flagship which government is looking at is the national digital health ecosystem in the age of digitization and rollout of 5G technology. That would make healthcare accessible and to the needs of over 1.4 billion people in India. Because of lack of the availability of the internet in Indian ecosystem is hampering a lot of hampering a scale up of digital technology, and 5G will bridge that gap. And this is the problem which has been highlighted more and more so because of the pandemic. Digital registries, which has just been highlighted, will also enforce the health providers and the health facilities. The unique health identity, universal access to health facilities will provide under the National Digital Health Ecosystem access to healthcare digitally in the remotest area where even the primary healthcare centers are unavailable. The further push to digital mission, it is vital for the government to partner with the private sector and use the technology innovations coming from creative startups in the field. One of the points, as I mentioned earlier, is Drone Shakti, where government is using the most latest technology available in most of the countries, which is not even adopted widely in Western world, is to provide the healthcare reach to remotest area with the help of drone. And this could be used in multiple ways in the healthcare segment too. The other proposal in telehealth scheme involving Bangalore-based NIMHANS shows the importance given by the government to a large segment of population that was stressed out following the pandemic, and is part of what the finance minister said about empathy for the pandemic hit population. As the national digital health ecosystem, which has been strengthened over the last few years, may accelerate the regular screenings for non-communicable diseases across urban and rural PHCs. And that is being piloted now through National Health Mission and National Urban Health Mission to catch up the lost time during the COVID pandemic emergencies. Incorporating this NCD's clinic in line with public-private partnership with wellness centers or at PHC may be promising. So what we have seen here is in last few years, there are a lot of screenings which can be reached out to these areas without the need of opening up a fully staffed primary healthcare center is going to change the way we can capture the 1 billion population outreach, which includes the things like screenings in a briefcase or a screening in a self-sustaining health kiosks, which are going to be able to provide that outreach through backed by telemedicine, so that people in India can get access to healthcare whenever they want and when they need it. 80% of population in India may not require tertiary care immediately, but the problem which is persistent, where things get identified in people and around healthcare when it is too late, is basically going to get bridged with the help of these portable devices, with the help of telemedicine, with the help of lab at home. So government's initiative to be able to take that seriously, and including private companies and startups to enforce and build out this infrastructure may be noteworthy. Some of the noteworthy things which has been highlighted into the budgets of 2 lakh Anganwadis to be upgraded to Saksham Anganwadis, integrated architecture, Mission Shakti, Mission Vatsalya, and also, as I mentioned, that the enforcing telehealth to include mental health program with the partnership with NIMHANS, and again, national digital health ecosystem will be strengthened, rolled out nationally the ID system so that the people and the providers can exchange data, have access to everything they have on their health anytime, everywhere in a standardized way. These are some of the features which highlighted in our budget on the healthcare, strengthening the healthcare ecosystem in India, and they are much needed. They're need of the hour for Indian people. The advancement and the acceleration, the scale up India is showing up in incorporating startups and private players will be the best move to take the healthcare forward. And also looking at increasing the percent GDP spent by government with private player focus on the health in the startup will be able to take us into the next era of strengthening health and wellness of Indian people.
For more updates from CXO TV, please like and subscribe to our channel.